My name is Toke-Ayeni. I'm a graduate student of the Kaiser University. I'm here to make a presentation on the biopsychosocial review on smoking. First, I would like to give an overview on smoking. Some scholars, Falk and Wagner-Lees, define smoking as an inhalation and exhalation of fumes of burning tobacco. Tobacco was not initially viewed as dangerous or harmful because it was used for the relief of tension during world wars. But in the early 70s, the clinical researchers revealed that smoking was the major cause of diseases such as lung cancer, pneumonia, bronchitis, diabetic complications, and post-surgery infections. The Diagnostic Manual of Mental Disorders classified tobacco as one of the addictive substances that, when in contact with the brain, enhances the brain reward system, also dealing with reinforcement behaviors and production of memories. More so, abuses assume pathological pattern such that the individual continues the uses of the substance despite being aware of the dangerous effect. This is because such individuals cannot function normally without the use of the substance. This paper presents a sequence of reviews of previous and current authors on the biopsychosocial factors for smoking. It also highlights how biological, psychological factors contribute to the development of smoking. Also, evaluating the effectiveness of various intervention methods. One of the recent reviews by Oliver Liebman and Fraser 2007 highlights on a biopsychosocial view to smoking. The authors reported an increased trend among psychiatric patients. They pointed out the fact that the percentage of smoking prevalence among psychiatric patients is on the increase from 70 to 90%. The biological explanation given for the occurrence of nicotine usage was that nicotine contains over 4,000 compounds, which activates the brain cells on contact, bringing about the release of dopamine. The psychological explanation for the phenomenon has to do with the psychiatric patients who do not have the capacity to cope with the symptoms of the mental condition. Thereby, they need to depend on the material for daily survival. The medical practitioners also use tobacco as a medical compliance or for controlling violent behaviors. A quick look at the information provided by Oliver Liebman and Fraser gives a direction that clinicians are mostly responsible for the smoking behaviors among the psychiatric patients because of the wrong usage of the method of reinforcement. They should be enlightened on the disadvantages of using cigarette as a major reinforcement. They should learn healthier methods to reduce and possibly quit smoking. A similar assertion was done by Oliveira in an empirical study, which highlighted on the fact that tobacco was responsible for majority of death cases. Having looked at their theoretical framework, it could be seen that the number of psychiatric patients who are dependent on tobacco in the Brazilian international scientific literature gave a figure of 1,812. In order to investigate this, about 96 patients who were mentally retarded were randomly selected for a 43-minute interview, while the tobacco level dependence was assessed through a reliable test. Results revealed that most of the inpatients had 3 times dependence on tobacco than patients who do not have a history of being hospitalized. Although the authors were able to provide a statistical analysis, but we do not have a reliable framework as a background for their study. In addition, the sample size was too small to obtain sufficient data that could be computed to determine the magnitude of the effect of the independent variables on the dependent variable. However, this points a future direction to intending workers so as to work on the design and the psychometric properties of the study. Next is a similar study made by Hughes. This was an attempt to investigate the possibility of smoking among psychiatric patients. In order to investigate this, about 277 patients of the General Hospital Psychiatric Clinic in Minnesota Medicare were recruited and asked to fill out a questionnaire to assess their psychiatric conditions. A control group was also randomly selected, making use of 1,440 Minnesotans and 17,000 U.S. citizens from the 1980-81 population census data. Psychiatric diagnoses were based on the DSM-3 Mental Disorders Manual. Results indicated that a larger percentage of the psychiatric patients were found with smoking habits as compared to the control population in the ratio of 52% to 30%. This is a commendable effort by the authors, but there are better designs that could produce better outcomes. The design used by the authors is also not reliable. There is need for a future input by intended researchers. Next is a highlight on psychosocial factors which could be responsible for smoking behavior at various age ranges. The first was done by Avenoli and Megarides to investigate the level of social network, biological and genetic factors that could be responsible for smoking habits among adolescents. This study was conducted at different areas using a survey both at school and at home. The construct measured were tobacco-related behavior within the family, associated risk, and time of assessment. Results were computed using a univariate, multivariate, and linear regression, which indicated that siblings and peer pressure had more predictive power on adolescent smoking behavior than parental influence. This is an indication that psychosocial factors could predict smoking behaviors, but future directions will still focus on the level of prediction between the independent variables, thus revealing the level of collinearity among the variables such as to avoid erroneous decisions. Next is an empirical study done by Liu et al. To investigate factors responsible for the smoking behaviors of the Chinese coal miners. This was because the investigators found out that coal mining is very stressful. Therefore, there are occupational stress attached to the job. The workers decide to adapt to the hazards of the job using an unhealthy method. Investigations were made by the authors using a questionnaire and recruiting miners from 6 coals refinery. Demographic factors and educational status and occupational stresses were assessed. An ANOVA was conducted. ANOVA was conducted so as to determine how effective the study was. The results of the ANOVA indicated that most of the coal miners who had low economic status, who were married, also had high tendencies of smoking. Its results also show that smoking was higher in coal miners who were of low economic status. Despite the statistical computations, a question that remains unanswered is to decide which of the variables best predicts the smoking behaviors of coal miners. So, it is highly recommendable that smoking cessation programs, especially for coal miners, include behavioral techniques. A similar review was on the role of social network, mass media, and environmental factors on smoking habits among asthmatic students. The scholars identified the fact that asthma is a chronic disease that could lead to a low quality of life. But the question remains, why do students still indulge in this injurious act? To identify or investigate this issue, a large sample size of 82 students were recruited to participate in a survey which consisted of a heterogeneous population. However, 48 responded. Results indicated that students who were exposed to social media had more ability to get involved in smoking habits. This is to say that social media and social media characters that are in the social media who act as role models to children, and there is a need for good reinforcement to be put in the social media. More so, by putting positive role models, this would discourage smoking habits among children. The next are a couple of intervention processes made by different authors. The first authors identified that behavioral intervention is associated with smoking cessation, and that tobacco smoking is a learned behavior which leads to addictive behaviors, affirming the necessity to include behavioral and pharmacological support in intervention programs. So,